Hey guys, Russell Linville here. Hey, this is Become a Better Human Project. It's a 2 Cent Tuesday, and what we're talking about today is movement patterns. How much do they really matter? I got into a debate with one of my coworkers here about how strict should we be on technique and form. And it's a very coming from a PT world and a strength conditioning world. All your mentors and you're always taught do things with perfect form. But as I'm out here practicing, I'm noticing that there's certain patients that fall into certain, use a Kelly Starrett term here, archetypes of movement. And my conclusion, or what I'm trying to think about is that normal for them? Right? We know that certain movement patterns make people a higher risk for injuries. For instance, if you're late in your delivery during a throwing motion, you might be more apt to have medial elbow pain because you have poor kinetic chain efficiency. If you're a teenage soccer player who has poor, lower extremity strength or ability to distribute force, and your knees collapse into dynamic valgus and hip internal rotation, we know that that's probably a risk factor for tearing your ACL. But what I want to kind of tune in on is this, should we be training these positions? I've heard, throughout the interwebs and talking to some of my colleagues here about training these positions that usually might create an injury so that the patient can adapt, and when they're tasked with this position during their movement pattern when they're participating in sport, the theory is that they're better able to adapt and overcome this position rather than it leading to an injury. Now, in the case of the thrower that I mentioned earlier, that's a repetitive, chronic overload type of situation, right? You throw poorly thousands of times, might blow your elbow out. Keyword there is might, by the way. If you're a soccer player and you move poorly, what we call the industry standard of moving poorly, is that something that we can, affect? Can we train in those positions every once in a while and make sure it's okay, right? Do I need to sit there, and if I'm having one of my, female soccer players who's recovering from ACL, they're finally back to doing some jump and hop testing. If their knee dives into valgus once every 10 reps, do I need to be concerned about that and stop them right away and say, hey, your knee dove into valgus, don't do that. Make sure you keep your knees out, chest up. Or do I allow them to make that mistake so that their body can realize and overcome that positional fault? And I think I'm more apt to go down that line, right? And some of these athletes who are this close to going back to sport, I want to stress them a little bit like their sport demands, right? You want to make sure that they can tolerate the load of going back to sport or the stress of going back to sport. And that's why here we do a lot of reactive agility. We put them in positions that make them not only use their body, but use their minds, how to react to different situations. And a lot of times these people will just instinctively move in a certain way, and they're not going to be thinking about their knee position or their elbow position or their arm position, their trunk position when they're doing a movement. It's our job to build up to the point where they don't have to really care about that anymore. Yeah, it might be in the back of their mind, but when they're reacting or shifting to cover a defender or whatever their sport demands, we want to make sure that they're ready to accept that sort of demand and stress. So movement patterns. There's a time and a place, I think. We really need to coach up good movement patterns early on, and then as the person's getting stronger and better and closer to sport, maybe we give them a little laxity on how strict we are. And you don't want to overcoach. I think that's what it all comes down to. So thanks, guys, for tuning in. This has Become a Better Human Project. Shoot me a message or comment. If you don't agree with me, that's fine. I'd love to start a talk about it. That's what these videos are about, right? Starting discussion. And we all have our different theories, so it's good to hear from you guys. Subscribe to the videos if you enjoy them, and thanks for tuning in.